Good evening, ladies and gentlemen. Thank you so much for joining us this evening for the webinar on bladder and bowel control. My name is Kenya. I'm with Medtronic. And this evening, we have a presentation that's going to be presented to you by Dr. Talanki and Dr. Shah. They are out in California and I am in Houston, Texas. But as we are waiting for the presentation to begin, please take a moment to fill out the poll that is on the screen in front of you. These questions help us gear our conversation as well as give good follow-up and allow us to understand what the need is. So again, as you are joining us, please take a moment to fill the poll out for us. A couple of things I'd like for you to keep in mind. This is anonymous and it is free. So we can't see and no one else can see your face or your name. So feel free to be comfortable in your own space. As we go along and you develop questions, please take the time to put those questions in the Q&A. And at the end, we will answer those questions for you. The presentation will be roughly between 15 and 25 minutes or so, depending on how the flow of everything goes. And then at the end, we'll open it up for questions and answers. And that's what we'll be answering the question that you put into the chat. There will also be one more poll at the end. We do want you to make sure you answer that one as well. So again, we'll be getting started in just a few minutes. I wanted to thank you again for joining us, and we'll be getting started shortly. Once again, thank you so much for joining us. My name is Kenya. I'm with Medtronic, and we are going to go ahead and get started. At this time, I'd like to introduce Dr. Talanki and Dr. Shah, who are with Tri-Valley Urology. We thank you both so much for taking on this webinar this evening, and at this time, the floor is all yours.
Thank you, Kenya. I'm Dr. Talanki. I'm joined by Dr. Shah. We're both physicians with Tri-Valley Urology in Murrieta. We're excited to talk about some issues, some bladder and bowel issues that we treat here at Tri-Valley Urology. Thank you all for joining and taking time out of your schedules to learn about bladder and bowel issues. So, okay, that's us. So some questions that I find that my patients often tell me that they've asked themselves are, will I ever regain control? Will I ever be able to attend an outdoor celebration? My patients with these issues often have trouble leaving home, stepping out of the house. Sometimes I've had patients tell me that every time they walk into a grocery store, the first thing they do is they're scanning around looking for the closest bathroom. So these are very common issues, more common than you may think. More than 50% of people with incontinence have never discussed it with their doctor, and 44% say that they're just too embarrassed to even discuss this issue. If any of this sounds like you or one of your loved ones, just know it's time for a change. Some other issues, some other things that people may mention if they have bladder or bowel problems are they urinate more than 8 times a day. They have sudden urges. They have the have to go now feeling. They plan their activities around going to the bathroom. They have to carefully monitor their fluid intake. Sometimes when it becomes very severe, they have to use pads to control their leaks. And at times they could even be getting up multiple times a night. So if any of this sounds like you, just know you're not alone. These are issues that we treat all day, and there's a lot we can do for this. Incontinence, it affects people of all ages. Ignoring these problems can lead to more serious problems, and a lot of people wait until it's causing these problems before they seek attention. Some of these issues could be loss of sleep, loss of self-confidence, loss of self-esteem, poor feelings about their general health. Bladder control problems are common. They affect 1 in 6 adults, and bladder and bowel problems affect 1 in 12 adults. And this is why we're here. The good news is there's a lot we can do for this. Some of the changes that you can make can really make a very positive difference in your life. Bladder and bowel treatments can get you back more freedom, more life, and more control. So ultimately, what causes bladder and bowel problems? This can include some of your own daily habits, including what you eat and drink. Sometimes caffeine, alcohol, soda consumption can contribute to this. Certain medications or supplements you take, any life changes such as pregnancy, childbirth, pelvic floor injury, or even any sort of surgery can affect your bladder and your bowels. And ultimately, how does bladder control work? The bladder and brain communicate, and this relationship is essential for bladder and bowel control. Kidneys produce urine, and they send the urine down to the bladder. And when the bladder is approximately half full, it can stimulate nerves in the brain, and these nerves then stimulate the bladder to empty. Any breakdown in this pathway can cause bladder and bowel problems. Unlike conventional therapy, the Medtronic bladder control therapy that we'll be discussing does stimulate the nerves in the pelvic area, and this can help you regain bladder control. Similarly, with bowel control, it's very similar. So the brain plays a central role in this. The digestive system pushes food through your intestines, and when the food reaches your rectum, it stimulates nerves that then send signals to your brain. These signals then the brain then signals the rectum and sphincter to relax and empty your bowels. Any kind of disruption in this entire pathway can cause bowel issues. And again, the Medtronic Interstim technology that we're going to talk about does directly affect the nerves in the pelvis to help regain this control. There are a few different types of bladder control problems. So there's the first one I'll talk about is stress incontinence. There's urinary retention and overactive bladder. With the first one, so stress incontinence is a very common type of incontinence. So this is leakage of urine when you have any form of stressor, such as a sneeze, cough, or laugh. Sometimes people tell me that as soon as they get up, they start to leak, or exercise, they bend over, they start leaking. Even leakage when you climb stairs or stand up too quickly can occur. So a lot of people with stress incontinence, they tend to have to urinate all the time to keep their bladder empty so that they don't leak. So this is a very common issue. Similarly, urinary retention is another bladder problem. So this, in a lot of people with urinary retention, they have trouble telling if their bladder is full. They retain urine, they're unable to fully empty their bladder. Someone with urinary retention may have a weak or dribbling stream. And if it becomes very severe, some people are reliant on catheters to keep their bladder empty. And finally, an overactive bladder is sort of what it sounds like. So an overactive bladder is when it's hyperactive. So somebody with an overactive bladder can have urge incontinence, where they need to, they start dribbling before they even reach the bathroom. Somebody with urge incontinence would have frequent leaks, even after just drinking a small amount of liquid. Sometimes even just hearing running water can cause you to leak. And if it becomes severe enough, a lot of people end up becoming reliant on using pads or protective garments. Sometimes an overactive bladder can also cause frequency, such as frequent uncontrollable urges to go, getting up more than 8 times a day, even at night, getting up to urinate, and feeling like your bladder is just never empty. You're always going. Fecal incontinence is another issue that we treat. So with fecal incontinence, this is having an involuntary loss of stool. So in somebody with fecal incontinence, they may have the inability to stop the urge to go. They may have passive incontinence, which is inability to feel when you need to go. And they feel like a lot of my patients with bowel and bladder problems, have difficulty planning their activities. They're always planning activities around the bathroom. Occasionally they can have involuntary loss of stool. Stool can be present every time they urinate, stained underpants, and being reliant on pads or protective garments. So these are very common problems. So I'm going to turn it over to Dr. Shah. She's going to go over some of the therapies that we offer, some of the treatments, and how to get you better.
So the most important thing to know about treating any sort of bowel or bladder issue is one, that there's options for you. So whoever you see for this problem should offer you multiple things. And because these are mainly quality of life treatments, you get to decide what's the best for you for the most part, depending on your goals and your values and your lifestyle and all that. So, these little circles here list a few different categories of treatment options for bowel and bladder issues. One category is lifestyle changes. Usually we think of these things as low risk modifications that you can make to your daily life that can help your symptoms. A lot of times from our perspective, we see them as low-hanging fruit, like maybe changing your diet or something like that. But again, if it's something that's important to your quality of life, you by no means have to change anything. The next category is to try oral medications. These are medications that we can prescribe to help you with bowel or bladder issues. And then there are advanced therapies, and those are primarily procedures. Some of them we can do in the office, and some of them we need to do in the operating room. The treatments that I'm going to focus on, by the way, are primarily for overactive bladder and urgency incontinence. We won't discuss treatments for stress incontinence today, and then also for fecal incontinence or accidental bowel leakage. So let's just start by talking about what lifestyle changes or behavioral modifications you can make. For overactive bladder, we think that lifestyle changes can help about 50% of people, but for other people, they may not work. So diet is probably the biggest one. Minimizing bladder irritants can often really help bladder symptoms. Bladder irritants are any drinks that contain caffeine, carbonation, or alcohol. And if you have trouble remembering, it's just everything that is delicious, essentially. And so minimizing those can help the bladder because you're not only drinking fluid that will lead you to have to urinate, but also these irritants directly irritate the lining of the bladder and make you feel like you have to urinate even when the bladder is not full. As far as fecal incontinence, the main factor in diet that can help those symptoms is increasing your intake of fiber. And some studies show that the type of fiber that you drink, like Metamucil, Citracel, Benefiber, specifically can help with that problem of fecal incontinence. The other interventions listed on this slide are best done in conjunction with one another. And for most people, they're best done with the assistance of a pelvic floor physical therapist. So the pelvic floor plays a crucial role in any bowel or bladder issue. And the pelvic floor does not work in isolation. You can kind of think about it like if you go to physical therapy for neck pain, you're not just going to be doing neck contractions or neck stretching to treat that pain. They'll evaluate your back, your posture, your shoulder strength, etc. So it's the same with the pelvic floor. Pelvic floor strengthening or Kegels that are listed here, that's one part of strengthening the pelvic floor, but also a pelvic floor physical therapist would help evaluate your core, your abdominal muscles, your lower back, your pressure management, all that. Bladder and bowel retraining or biofeedback is a tool that can help you become more aware of what your pelvic floor is doing when you're having urinary or defecatory dysfunction. And then you may be recommended to do different exercises to strengthen the other parts of the core. As far as oral medications, there are several different options. For the bladder, oral medications tend to work for about 80% of women, we estimate. The problem with the medications is that they often come with side effects, and it's really hard to remember to take a medication every day. So some of the side effects are listed here, but they include dry mouth, blurry vision, constipation, and high blood pressure. Not everybody is affected by these, but many women are. And then because of these side effects and the requirement that you have to take a medication every day, some of them you take more than one day, often people end up discontinuing the medications. So in this little blurb here, it says at 6 months, 72% of women discontinue the medications. In general, we think that at the end of 1 year, 12 months, only 1 in 4 women who's prescribed medications is still taking them. So they're effective, but they're just hard to keep taking. This slide here just kind of drives home that a lot of patients are dissatisfied with medications. They work well for some people, but often, they're hard to stick with. So now, and then one small thing here. As far as the medications, there aren't any prescription medications that work well for the fecal incontinence, but there is an over-the-counter option, and that's to take Imodium as needed. And so again, it's kind of like a Band-Aid on the problem. It works for some people, not that effective for others. And then often people find it irritating to have to take a medication constantly for that issue. As far as advanced therapies, as I mentioned, there's some that can be done in the office and some that can be done in the operating room. So the different options are listed here on this slide under the bladder and the bowel control boxes, and we'll discuss each of them in a little bit more detail. So let's start by talking about Botox. Many of you are probably familiar with Botox injections in the face, but Botox can also be injected into the bladder. And the way Botox works is actually by partially paralyzing the bladder muscle, so you can hold more urine, which means you can urinate less frequently. And also you don't get those bothersome bladder spasms that lead to sudden urgency and the leakage that you feel on the way to the bathroom, or when you hear running water, or just randomly that occurs when you're running errands. The way these injections are done is by a skinny little camera that goes through the urethra and into the bladder, and then a tiny needle is used to inject the Botox into different areas of the bladder. And the Botox is effective. It works for about 80% of women. It doesn't address, brain-bladder communication, which we think is the ultimate underlying cause of overactive bladder, but it does affect the ability of the bladder muscle to relax and not have spasms. The main side effect of the Botox to know about is that in a little less than 5% of people, it may work too well, and it may cause difficulties with emptying the bladder. So instead of leaking, you may not be able to urinate. And if you're really unable to urinate, then you may have to catheterize to drain the bladder. And usually we recommend self-catheterizing, so passing a little catheter through the urethra.
That's a temporary side effect.
Yeah, until the Botox wears off, which would be weeks to months. And the Botox is done in the office. Another office procedure is PTNS or PTNM, which stands for percutaneous tibial nerve stimulation or neuromodulation. And Medtronic offers one of these therapies, which is called the Neuro System. PTNS is an acupuncture-based treatment where, as you can see in this picture, a little needle is put into the medial side of the leg, and then a little skin pad is put under the foot. And we've found that giving electrical stimulation to the one of the nerves in the leg, the posterior tibial nerve the posterior tibial nerve, regulates the communication between the brain and the bladder. So in someone with overactive bladder, we think that there's too many faulty signals going from the brain to the bladder, and the PTNS or PTNM helps regulate those signals to make it a little quieter. So it's overall safe, it's minimally invasive. It's not the most effective treatment. It works for about 50% of women, but it is probably by far the lowest risk, even lower risk than medications. And it can work to reduce urgency, frequency, and urinary incontinence. There was a recent study where they tried to see if this can help women with fecal incontinence, and unfortunately it didn't look like it was effective, but it can definitely help with the bladder function. The way this therapy is delivered is that you have to come to the office weekly for 12 weeks and be there for 30 minutes to receive the treatment. And during the treatment, you can you have to be seated, you can't be walking around. So you have to be able to come into the clinic that often. After the 12 weeks, often we can do treatments less often, like monthly, to maintain the effect of the PTNS or the PTNM. And then lastly, there's a procedure called sacral neuromodulation that Medtronic offers, and their system is called Interstim. And this is another procedure that can help with both bladder and bowel function. And essentially what we do in this surgery is we put a tiny little implant into the very lower end of the spine and the sacrum, and it works as a pacemaker for the nerves that go to the bladder and the bowels. And so the sacral neuromodulation device sends constant signals that again help regulate the communication between the brain and the bladder and the brain and the bowel. For many women, that they like this better than medication, it works better for them. The way that we do this procedure is in 2 phases, essentially. There's a test phase where we put in usually like 2 little wires, one on each side, and this can be done in the office. And then you take those home and you test out the therapy for a week. And we have you complete bowel or bladder diaries for a few days before and a few days after, and we compare to see how it's working for you. The change that we're looking for is a 50% or greater improvement in your symptoms. There is also a test that can be done in the operating room, either based on patient preference or if you have complicated, like any complicated medical problems or complicated anatomy, like if you've had very many back surgeries, we offer that test with fluoroscopy in the operating room. And then if you feel that after the test phase that you've had a positive improvement in your symptoms, then you can go on to have the permanent device implanted. And that comes in 2 different options of the battery. There's a battery that you don't have to charge that is supposed to last for 5 or 10 years and you don't worry about charging it. Or sorry, 10 to 15 years, I think. And then there's a battery that you can recharge that you do every so often. And that I believe is the one that lasts longer, sorry, 10 to 15 years. So you can choose between those. Now, one common question that we get from patients, isn't there an MRI thing? No, anyways, okay. Well, so a lot of people, as you can see worldwide, have had this therapy. Like I mentioned, you can do the test in the doctor's office with the small wire and the lead, and then test it out for 7 to 14 days and record your symptoms. And then when they look 5 years later for people who have had this therapy, it's still successful in about 80%. This is the slide I was looking for. I was going to mention that a lot of patients need to have MRIs for whatever reason. Maybe you have back pain, maybe you have, some other problem where you need an MRI of the brain or anything. And these Interstim devices are compatible with MRIs, and truly they cover most MRIs that you would need. And so that's something that is good to know if you're considering getting this device. So, who would be good for sacral neuromodulation surgery? Of course, if you have significant symptoms that are affecting your quality of life, if you've already tried the low risk stuff like lifestyle changes and oral medications, and if you're still having bothersome symptoms without enough relief. And then this slide again, it just shows that Medtronic has done a lot of research studies looking into this, and all their studies have shown high patient satisfaction. So now we're happy to take any questions from you all. That was kind of just a brief overview of what bowel and bladder symptoms entail and what treatment options are available.
Thank you both so very, very, very much for doing that. We are going to open up the question and answers at this time. And in addition to that, as promised, there is another poll that's going to pop up on your screen. If you will take a minute and complete that for us, we would greatly appreciate it. So I want to go ahead and get into the questions. Many of you, if you were following along and you were thinking about a couple of things or you weren't sure, this is a perfect opportunity for you to go ahead and put your questions into the chat. So give me a second to read through this just so I'm sure as to what the question is asking. Well, the first question, someone wants to know, what is the recovery after having the procedure done?
Yeah, I can explain that. So there are two procedures. There's the first one is just the trial. So for the trial, it's a quick office procedure where we just place the temporary leads in someone's back. It's taped to their skin. Recovery for that is really just in terms of kind of keeping the bandage in place, making sure it doesn't get wet. Things like that. There isn't really a major recovery for that. Now, in terms of the full implant, say you had success with it, it worked, you're satisfied with the way that your bowel and bladder habits are, then for that one, that's a permanent device. It goes under your skin. For that one, so the recovery after that is about, I typically tell patients not to shower for 48 hours, no swimming, submerging for 2 to 3 weeks. and no major heavy lifting, not too much bending for 2 to 3 weeks after. Aside from that, there aren't really too many long-term restrictions or anything like that. It's really just for that first approximately 1 month that you have some small restrictions.
Thank you.
The incisions that you get from the surgery to implant the permanent things, they're very minimal. There's one that is about 4 centimeters. So people do really well pain-wise. And then the other is like 0.5 centimeter. So really, we just want enough time for the device not to be moving around for you to heal. But pain-wise, people do great.
Okay, next question is this for men as well?
Yes, it is. Yeah, so I treat a lot of men with this problem. What does complicate it a little bit in men is men have prostates. So we're always want to be thorough and make sure that it's usually a combination of both the problems, but the bladder can definitely become hyperactive and cause all sorts of issues, even the fecal issues. I treat a lot of men with this problem and they've had a lot of success.
Next question, is this covered by scan insurance?
I believe so.
Should be.
Yeah. I've done a lot of patients who have scan. Obviously, it's always good to check with insurance, and we always, whenever we do this procedure, we always run everything through the insurance, make sure it's covered. I believe right now, I mean, I don't think there's any insurance that I can think of right now that does not cover this.
And it's popping in here a couple of times, so I'm just going to say the question again, and I know you've answered it, but there's like 4 other people that have asked. It seems to be, is this equally effective for men and women? And then how often are men getting it compared to women?
Well, I treat men and women with this, so I would say, I mean, if I had to just think offhand, I would say about 80% of my patients who get this are women, 20% are men. I think that's just because of how much more of a problem this may be, how much more common overactive bladder may be in women. But I think that it's equally effective. I think that men and women both have success with it. And the nice thing about it is we always do a trial first to see if it would even work.
Perfect. Next question. I go to the gym 2 to 3 days a week. Can I work out during this time? And I would assume they're asking during the testing, and then are they going to be able to work out after if they get the implant?
During the testing and for 2 weeks after getting the permanent implant, I generally recommend against vigorous activity, especially things that can cause a lot of sweating. Just because during the test, those little wires that we put in, they're pretty flimsy, and it's intentional because we want to be able to take them out in the clinic and we want it to be as minimally invasive as possible. So to get the best test, you probably don't want to exercise a whole lot during that time. And then when you're healing from the surgery, it's just a limited amount of time to make sure the implant stays in the right place, the battery stays in the right place, you don't have any infections or complications. So I'd probably recommend against it. However, you can walk as much as tolerated if you wanted to do something that doesn't involve a lot of sweating or vigorous activity like yoga or physical therapy, things like that. And I mean, you can continue all those things.
Thank you. Next question is, are the Medtronic treatments accepted by Medicare?
Yes.
Yes, it is. Yep.
Next question. What if you have disc compression and stenosis in the lower spine and sacrum?
I think with some of these, we go case by case. The nice thing about it is we do a trial. I mean, there are a handful of patients where we do trials, and sometimes those neurologic issues may just be too severe to treat. But I've had a lot of success with people with spinal stenosis, with lumbar issues, herniated discs. Had a lot of success because a lot of their problems could really be a neurological problem like that, where that communication between the brain and the bladder is breaking down.
Thank you. Does that apply if you do not have a prostate?
I think it works even better if you don't have a prostate. So I think that if you have an overactive bladder and say you've had the surgery for your prostate or whatever it might be, and you're still having this problem, then you can really narrow it down to overactive bladder at that point. So I've had a lot of success in men after a prostatectomy surgery or any kind of prostate surgery where they've had relief from their prostate, but now they still have a hyperactive bladder. a lot of success in those guys.
This may be a deferred question, but I want to make sure that I ask it anyway. The question says, my wife is currently on estrogen ring for GSM. She has no leakage, just urgency and not emptying. What advanced procedure would work best for Alzheimer patient?
I think it's hard to say. I mean, the first thing would be to confirm the diagnosis that's behind the urinary urgency and frequency if she has that. So one cause of that can be overactive bladder. GSM can be another cause of that. There's also a number of other pathologies with the bladder or, pelvic issues that can cause urinary urgency. So the treatment would depend on what's causing it. And then it's always really tricky to do a procedure on somebody who has Alzheimer's. When we're dealing with quality of life issues, like I mentioned, the input that you have is really important to selecting the right therapy. And also with selecting a procedure like sacral neuromodulation, where you do have a little control that you can use to adjust the settings of the device. It's tricky depending on, I guess, how bad the Alzheimer's is, but it could potentially be an option for her depending.
Thank you. And I'm noticing as we are answering the questions, we're increasing the number of patients that are saying they would love to have an appointment. So feel free to continue to fill out the poll that's there. And if you want to have an appointment, by all means, go ahead and click the poll and fill that out for us. The contact number for the office is on the screen as well. So if you want to jot that down, you're free to call as well, but someone will follow up with you following this webinar. Let me go ahead and finish asking the questions. What can cause a sense of having an urgent frequency? After 20 minutes or so, I find myself using the restroom. I do drink a lot of water and soft drinks. No other symptoms.
There's a lot of different things, like I was mentioning, that can cause urinary frequency. Maybe what I can do is list a lot of the common causes in women, since I'm a urogynecologist and I only treat women, and then Dr. Talanki can tell you more about the causes that may be more specific to men. So urinary frequency, can be, of course, caused by overactive bladder, like we mentioned. It can be caused to a number of vulvar and vaginal issues. So, if you're doing some initial treatments that aren't working, we always make sure to do a pelvic exam to make sure there's no findings there that could explain the frequency, such as genitourinary syndrome of menopause, or a pelvic mass, or a tumor in the bladder, or something like that. There's also some different pain syndromes that can cause urinary frequency. And a big one is bladder pain syndrome or interstitial cystitis, which can look a lot like overactive bladder. But the difference is that people with this condition are driven to urinate by a feeling of discomfort or pain that makes it feel like they always have to go. Those are some of the more common ones. And then a really common one is also constipation or any other issue with the bowel, like irritable bowel syndrome. The bladder and the bowel sit right next to each other. And so if you have a lot of stool that's backed up, it can put a lot of pressure on the bladder and, again, make it feel like you have to go constantly. This person may have answered their question. Another cause can be drinking an excessive amount of water, or drinking many soft drinks, because those are under the category of bladder irritants. So that also could potentially be a cause or a contributing factor.
Yeah, I mean, based on those symptoms, if somebody told me they had that, the first thing I would really be looking at is overactive bladder. And these are the treatments that we just mentioned in the talk, maybe something that would benefit this person. When we evaluate somebody in the office, man or woman, we're trying to rule out everything else first. I mean, that's kind of the purpose of it, because we want to be certain that if someone's going to proceed with any kind of procedure, medication, treatment, we want it to work. So that's kind of what we look for. But it sounds like you're kind of almost like a textbook person that would benefit from treatment for overactive bladder, especially if these symptoms are something that really bother you.
Thank you. The next question is regarding Botox. How long does it last before wearing off?
We usually estimate like 3 to 9 months.
Yeah, I tell people about 6 months. Yeah. Okay, you answered that one, but it came in here again. That's okay. I think it may be
a matter of when someone may have logged on and they may have missed the presentation, and that's perfectly fine. We are going to provide this webinar to you via email or the way in which you register. You will have access to the webinar if you want to go ahead and watch it again. I do want to go ahead and finish up the questions. What will be effective after prostate has been removed? And I think you did answer this in a different kind of a way, but I did want to ask it.
After a prostatectomy, we really want to be certain that there are different types of incontinence that I mentioned in one of the slides. After someone has their entire prostate removed, part of it could be overactive bladder that can cause leakage, urgency, frequency. But something else that's very high on our differential when someone has a prostate removed was there some issue with the sphincter? So was the sphincter affected by it? So if the sphincter is affected by it, a man can develop stress incontinence, which is leakage when they cough, laugh, sneeze, get up, when they're at the gym. So it's important to distinguish overactive bladder from stress incontinence. And the reason behind that is the treatments are completely different. So that's why after prostatectomy, it definitely puts you at risk for bladder problems. And there are a lot of treatments we can do for them. It's just trying to kind of delineate which problem it is, which bladder problem somebody's having. But there's a lot of treatments, a lot of therapies we can do for either one.
Okay, I am doing the acupuncture nerve treatment now. The first 7 to 8 weeks, it was amazing results, but I had to miss a couple of weeks in the last of the 12-week treatment. And I noticed being back to peeing a lot and even waking up. Can someone use home TMS machine?
Yeah.
You can. It's called TTNS, transcutaneous tibial nerve stimulation. And it's still kind of an experimental treatment. It's not dangerous or anything like that. There's just few high quality studies in this area, but it's something that we were all experimenting with a little bit during COVID when we couldn't offer patients PTNS. We think that the TTNS so far, what it looks like is that it's basically the same effectiveness as a placebo, but people who did both the TTNS treatment and the placebo treatment and the research studies did have benefit. There's also a lot of different ways to do the TTNS treatments. So some people recommend it twice a week, some people recommend it every day. So it may be that we don't know the most effective protocol yet.
I have been put on Cure catheter for about a month. Will I get a UTI eventually?
Well, yeah, the tricky thing there is, I mean, needing a catheter does put you at a higher risk of a urinary tract infection. But it kind of depends on why you were put on the catheter as well, because if somebody's having trouble emptying their bladder, which is the most common reason for needing a catheter, that can also put you at risk of infection. So the tricky thing is that if you need a catheter to empty your bladder, that's more beneficial than not using the catheter and having retention. So it's definitely possible. That's why you really should go by your doctor's advice. Make sure that you're using a new catheter every single time when you self-catheterize, things like that.
What if you have other implants like a sleep apnea?
Usually it's fine.
Yeah, I've done it with people with the Inspire device for sleep apnea, and also with other like pacemakers in their heart. No issues at all.
I have Parkinson's, tried everything from meds to Botox, etc. I can wear a diaper for 24 hours, 7 days a week. Will this help me?
Maybe it can be used for patients with neurogenic bladder, so people who have Parkinson's or multiple sclerosis, things like that. In those populations, sometimes we see that the sacral neuromodulation therapy is a little bit less effective. But again, that's the beauty of doing that trial. It can really give you an idea of how your symptoms would improve.
Actually, there's one question here I want to answer. So can aquablation result in an overactive bladder? So aquablation is a therapy that we do quite often for enlarged prostate problems. And basically we find that anybody with a prostate issue, if you treat the prostate issue, you get better flow, but it can uncover an overactive bladder. So I've done this sort of therapy in men who've had prostate procedures, whether it was a Urolift or TURP or even an aqua ablation, and all of a sudden now they're urinating better, they're emptying their bladder better, but they're having more urgency, frequency, and a lot of times that's been uncovered because the bladder is not obstructed anymore by their prostate. So I've had a lot of success in this sort of therapy in men who've had prostate treatment done.
I have an overactive bladder and I cannot take medications. What is the easiest and best treatment to help with that?
This one's hard because currently, as it stands, every insurance company except Kaiser is the only one I know of requires you to try 2 overactive bladder medications before moving on to those advanced therapies that we talked about. Don't ask us why. We don't agree with it. It's not a medically necessary thing, but it is a hoop that we have to jump through. So I'd recommend, getting connected with a doctor and figuring out what we can do. Is there something we can do to help you take medications? If you are worried about side effects, there's a few different options. Or maybe it's a matter of talking to your insurance company and seeing if they'll approve another treatment for it.
And there's a question at the end that's in Spanish. I can read it, but I can't answer it. I don't understand it. I don't know if either of you speak Spanish.
It's not a question.
Okay, perfect. My personal doctor has to ask for authorization to see you. Does my personal doctor have to ask for authorization to see you?
Yeah, so I would definitely check with your insurance because it can sort of depend on your particular situation. Check with your insurance company first, and then if it's the case, which it can be with a lot of HMOs, then you would need a referral from your primary care doctor. And we take most HMOs that are in our practice in the area, so there's a very good chance that we'll be able to see you.
And most primary care doctors are happy to refer you over because they have a lot of other things to worry about when they're managing your health, and they'd love to connect you with care.
Are there effective treatments for those who have undergone radiation and Lupron treatment for prostate cancer?
Yeah, so the treatment is no different. I've done this in men who've had radiation and are on Lupron for prostate cancer. Radiation can definitely sort of induce an overactive bladder or uncover an overactive bladder. So if this is something that somebody's struggling with who's had radiation for prostate cancer, definitely I've treated patients with in this situation, and they've had a lot of success.
Okay, and the question is both RX and sleep apnea. I'm a senior and overweight. I have had some success, 2 to 3 trips at night versus 5 to 6. Did not tolerate RX. Are my results from weight loss or from using CPAP machine?
I would think probably from using the CPAP machine. Urinating at nighttime, there's a lot of different causes than just urinary frequency in the day and urgency like we were talking about. It's called nocturia, and it can be from overactive bladder, but it can also be due to a lot of different causes that make you produce more urine at night, and that's called nocturnal polyuria. One very common cause of nocturnal polyuria is sleep apnea. Basically, it makes your kidneys produce more urine at night. So if you're producing more urine at night, you're more likely to wake up and have to urinate. So treating the sleep apnea can make a big difference to urinating at nighttime.
And the last question that we'll take this evening says, I've tried a medication that worked great for the first 2 weeks and then slowly stopped helping. So I should ask for an additional medication?
Yeah, that's a good question. I think the best thing to do would be to bring that up with the urologist or physician that you're seeing, and it'll sort of depend on your situation. With most insurances, you do not all, but with most insurances, you do need to fail a second medication in order to qualify for what's called advanced therapy, such as neuromodulation or Interstim. But it really is a case-by-case basis, and we kind of look at everybody different, look at everybody kind of on an individual basis to make that decision.
Okay, I apologize. It seems that people are putting questions in multiple places, and I don't want anyone to feel like we are not addressing them. We went to the questions that were in the Q&A, and there are some in the chat. There's a patient asking, she has IC, do these apply?
Yeah, so we treat a lot of patients with IC, basically chronic bladder pain, pelvic pain. It's not technically approved for treatment of pelvic pain or IC. However, a lot of people with pelvic pain and IC also have an overactive bladder. And I can tell you just anecdotally that it has helped a lot of those people in terms of their pain, their IC symptoms. Insurance is always tricky when it comes to these sort of things, but in our experience, and I know that there are a lot of centers that treat IC and do this and offer this in patients with IC, we've seen a lot of success.
Thank you. And the question asks, for the procedure that goes into the lower leg, is this acupuncture? Is there a danger of not being able to urinate and needing a catheter?
No, there's no, I mean, I guess it's always possible, but there's not really a physiologic or logical risk of that happening. It's not exactly the same as acupuncture. The difference is that instead of just a needle being there, there's also a skin pad or something that delivers strong electrical stimulation. But in general, the side effects are pretty limited to a little bit of pain from the needle, maybe a very small amount of bleeding, or like irritation or discomfort from the skin pad. And if you stop doing it, the side effects go away.
Yeah, so the options, the treatments that we just listed that have the risk of needing to catheterize, the main one is Botox, which carries approximately a 5% risk of retention and needing to catheterize. The medications can also do that too. So depending on how you react to certain medications, there's also a small risk of that. There is not a direct risk from Interstim or neuromodulation, or a direct risk from PTNS or the acupuncture treatment.
Thank you. And this one says, if you have a sciatic nerve issue, do you still recommend the Medtronic device?
Sciatic nerve issue? Yeah, I mean, yeah, absolutely. I don't know if it would directly help your sciatic nerve issue, but it won't lessen the effectiveness or anything like that.
I have tibial neuropathy, bottom of foot. I read could trigger bladder spasms. More of a statement, I suppose.
Maybe. I mean, the body's all connected, so maybe you have this neuropathy and you're walking a different way and it's affecting your pelvic floor or something like that. It could indirectly trigger bladder spasms, but it's really unlikely to be the cause of your bladder issues. The other thing to consider is that perhaps the underlying process that is causing the neuropathy could be causing the bladder issue. So, for example, diabetes or multiple sclerosis and other diseases that affect the nerves can cause bladder and bowel problems.
Okay, I think that is the bulk. There seem to be a couple of repeated questions in there. As we said before, this webinar is going to be available for you to watch at a later date. We will send it out in a few days. If you were not able to join us at the very beginning, some of the questions that you may have probably were answered at the beginning. If not, we do encourage you to make an appointment with Dr. Shah or Dr. Talanki. The number for the office are on the screens. Many of your questions that you have, I'm sure will be able to be answered during one of the appointments that you have with them. If you did answer that you would like to be contacted, someone from our sales team or from the doctor's office will actually be giving you a call and following up with you. At this time, we would like to thank Dr. Talanki and Dr. Shah for their time this evening. It was very valuable and greatly appreciated. So at this time, we bid you a good night and thank you so much.
Thank you.
Thank you.
Thank you for joining.